Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The interview that you're about to see is with Mr. Bill Maybaum, a 39-year-old communications analyst who underwent jaw surgery some 5 years ago. Mr. Maybaum had a severe jaw discrepancy, which was unsuccessfully treated when he was an adolescent. And so some 20 years later, he sought orthodontic correction of his deformity. This involved the pre-surgical period of orthodontics in which the teeth were aligned within each jaw, and then the lower jaw was surgically advanced. As you'll see from this tape, there are both functional and psychological benefits to this combined surgical orthodontic procedure. We began the interview by asking him how it all began.
It started in a bowling alley. The nurse that worked with Dr. O'Connor at the VA hospital came up to me and asked me if I'd ever considered getting my overbite fixed. And I naturally responded I had thought about it very frequently, but economically couldn't afford it. And she said, well, you know, the VA's policies have been changed, and they would certainly consider it a case for corrective surgery. So she made an appointment with Dr. O'Connor, and I went to the VA hospital, and he took me by the hand through every department that was relevant, through the photography and the dental school, the dental group, to do x-rays. And we sat down and had a long conversation, and then he set up a second appointment. I came back on a second appointment, and he gave me his appraisal, and then he recommended that I come to see you as one of the alternatives, as opposed to a completely surgical correction, that there should be some orthodontics in combination with the surgery. So he sent me down to see you, and I guess it was early October, and I came back late October, and we got started.
How long were you aware that there was an orthodontic problem?
Well, since I would say I was maybe 5 to 7 years old, it really started developing quite badly. And I was teased quite frequently about it as a child, about the overbite, you know, looking like a rabbit, things of that nature. And I first had orthodontics when I was about 13 years old, and that lasted for about 2.5 years. Then I went in service, and I guess you'd call it a relapse started to set in. And that I got out of service in '63. And then, I guess it was 10 years later, I finally started a second process to correct it again.
You've recently found some home movies, which I think we are going to incorporate into this presentation. Would you like to make some comments regarding your retrospective impressions of seeing yourself in 1953?
Well, it was startling. I always knew I had an overbite, and I felt somewhat self-conscious about it. And I felt that more than anything, it really affected the way I ate. Chewing was virtually impossible. I felt that I look back upon it and wonder, you know, whether I would have survived or not if it continued without some kind of correction, even though it relapsed. Because I felt that I just couldn't chew food at all, and so you tend to gulp food down and not properly digest it. And I don't know whether that contributed to the fact that I would always seem to be underweight or not, but I think that was certainly a factor.
What do you remember about your first orthodontic experience?
It was uncomfortable, I guess, was the wires cutting into your lips and things of that nature. But I guess when you're young, it's a little bit more tolerable.
Did you have to wear headgear or any type of appliances that were worn outside the mouth?
No, I had no exterior appliances. The primary treatment was the banding and the wires, and I guess you'd call it, looked like a retainer type structure that I wore within the mouth to try to get the lower teeth to level out.
At what point in time were you aware that your orthodontics was not as successful as you would have hoped?
It's very difficult. I guess when I was in the service, I was frequently in the dental clinic. In fact, I guess my dental records exceeded my medical records by about 2 to 1. But the dentists there were commenting on it because of the work. It had changed the gum line configuration on the teeth themselves, and so I had a lot of trouble with the dental technicians who were not cognizant of the effects of orthodontics on the teeth, and they were telling me that I had gum recession because I wasn't brushing, and several things which I knew weren't true. And it was kind of a frustrating situation to be treated in that manner. Then when I was in the military, I applied for the Air Force Academy, and I had 2 appointments, but I couldn't make it because of my teeth. So I think that really firmed up the idea that there was still something wrong. Mm-hmm. And I think that was why I got out of service and continued, I guess, to look for a solution, at least not in a diligent manner, but try to maintain an awareness of it.
Retrospectively, do you think that your appearance affected the way you interacted in your job or in your family life?
I believe to some degree. I would have to say that's true. Obviously didn't spend a lot of time thinking about it, but I believe there was an impact there.
Would you like to comment on your orthodontic experience, the second orthodontic experience, as to what you remember and the types of feelings that you had going through that type of experience?
I would say the second time there was the same types of inconvenience with your teeth moving around, but I believe since I had a more clear-cut solution in sight, that is the surgery in combination with the orthodontics, that it, I guess would say it would raise my tolerance level to any other inconvenience, because the objective was quite clear that what I was going to get out of it, and I think that helped me tolerate the minor inconveniences of the teeth being sore and things of that nature.
You were in the hospital, I think, for about 5 days. I will comment that at the time we elected to do a sagittal split advancement of the mandible, and we also hemisected the mandible in the cuspid region to allow for the correction of a posterior crossbite. So he had his lower jaw sectioned into about 5 pieces. The amount of surgery in Bill's case, at least as far as the mandible is concerned, was very extensive. I think that we have, at least from an orthodontic point of view, I'm extremely satisfied with the procedure. Would you like to comment on from your own perspective as a patient, exactly what you went through during this period of time, both in the hospital and during the 4 to 6 weeks of fixation, which I think you experienced after the procedure?
Well, the surgery and the hospital experience went almost as planned, which I think helped ease the whole situation. Dr. Beers, the surgeon, and yourself had actually sat down and almost diagrammed every day's activities. And I think that actually alleviated most of my concerns or fears about what was going to happen, because I'm not normally a hospital patient. And so everything went as planned in the sense that Dr. Beers said they were going to, the pre-op situation, the operating room situation, the follow-up situation where he would come and visit every day, and that he explained what he was going to do, what was going to be in my mouth, the whole aspect there of the hospital stay. So I think it made it, in my mind, not a tense situation. In fact, the only problem I would say I had in the hospital experience was during the removal of the breathing tube and the stomach tube, because the breathing tube I wasn't aware of as far as the effects of removal, and since it tends to, one, make you gag, and with your mouth wired shut, your mouth doesn't open, and one tends to panic in one's mind. And I think I've followed through quite admirably on the panic situation, because everything went, kind of haywire. But the rest of the stay was no problem. In fact, I'm surprised I've suffered very little pain, very little swelling, discoloration. But I think that's primarily to Dr. Beers' pre-planning and following through with his, post-operative plan. So the hospital stay, the only inconvenient part there was the patient in the next bed was an old man that kept me up all night banging on his bed, but that wasn't bad. And then the period of recovery, the following 4 weeks, went quite well. My wife's the nurse, and we had prepared for that, so we had gone and looked for particular foods that one could get through a straw, and protein supplements, and so I was drinking about 6 to 8 times a day. In fact, I actually put on weight during the recovery period. So
yeah, it's usual for most surgery patients to lose up to 10 pounds, so I think you must have done quite well in that regard. Did you have any permanent problems as far as loss of feeling in your jaw?
I have only one small spot on my chin right there, about the size of a dime, and that's it.
But were you much more numb after the surgery? Often?
Oh yes, it was from here, just from the whole jaw. I could just feel it gradually, coming to the front, and then it actually felt like it was doing quite well. But Dr. Beers went in for one of the wires that he thought was causing me a problem on the right side, and I think that's when he might have caused this problem. But it's not a significant problem.
How did your wife react to the whole surgery and your kids? I don't know whether your children were old enough at that time to appreciate a change in Daddy's appearance, but would you like to comment on that?
Well, I think generally, my oldest son was 4.5 when I was in the hospital. He was quite concerned about the idea of being in the hospital, but it was difficult to get a reaction from him on my change. My wife thought it was a very positive change. The rest of my family concurred. They thought it looked very good.
Your children, both Eric and Robbie, have a similar jaw configuration to yourself. We started Eric with a Frankel appliance, a functional regulator, I think about 1975, and I would imagine that a layperson looking at Eric would find no problem as far as his jaw development. We also have Robbie, who now is 4 years of age and looks very much like I would imagine Bill would have looked at that age level. And we are now contemplating using a Frankel appliance or functional regulator in the second child as well. Do you want to comment on your experience of the surgery versus the functional appliance as a method of treatment? And if you had to do it over again, which way would you want to go?
I think it's quite easy to say I would have taken the Frankel. Not that the surgery was that bad of an experience. I felt in my particular situation it was probably the only solution. But given an opportunity, to get it at an early enough stage so that you can regulate it without contemplating surgery, to bring it back in, because Eric is 9 now, and very few people are even aware that he ever had a problem. And he has no problem chewing. He has a very attractive smile. His teeth are in beautiful alignment. As compared to Robbie, who's 4, who has an overbite that is on the order of mine, it becomes, to me, a paramount importance to get it fixed. Because the effect, I believe, in their childhood years is dramatic. I think it really affects their personality when they get harassed about the overbite and things of this nature. And I think it can have a detrimental effect in the long term on their personality.
What was the most positive aspect of your whole orthognathic surgical experience?
It just makes me feel better. It's very difficult to say what's the most positive. I think it has affected me in my personal life. It's affected me in business. I think it has given me more self-confidence because I feel that I'm considerably better looking than what I used to be. But I feel that I eat a lot better. I feel that chewing food now is not a difficult situation. It's easy to do. Mm-hmm. I tend to feel like I eat less because I just chew it longer as opposed to a gulping type function. And so food actually becomes more enjoyable.
What is the most difficult aspect of the treatment that you've received?
I guess, just the surgery is the most difficult part of it, but the forbearance to go through it, I think, it alleviates all of it, because, looking at the pictures that we have of before and after, it's almost like, there was no doubt. I mean, how could you choose not to do this? Mm-hmm. It's, I think, that kind of an improvement.
Would you do it again?
I believe I would. I don't believe I would have any hesitation. I would certainly be concerned about doing it again in the sense of doing it again.
Yes, I understand.
But if it was necessary, I certainly would do it.
Are there any other comments that you'd like to make for a potential surgery patient, of things that they should look out for or be concerned with?
No, I think the big thing is just understanding what you're getting ready to do and being willing to make that personal commitment to do it. it's not anything you can have to. And if you're going to do it, you've got to do it all the way and stay with it through the thick and thin, so to speak, and the good and the bad. The ups and the downs, and it tends to fade away. You know, it doesn't, when I look back on it, it doesn't look, in general, it's that bad an experience. It took quite a few years and a lot of people's effort and cooperation, but it's, you know, to me, it's well worth it.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.